Now to a Team 10 investigation. Hundreds of thousands of dollars spent by the county for extra ambulances.
The goal was to help with the service delays, but there are questions on how often the resources were actually used. Our Team 10 investigator, Melissa Messiha, shows us what she discovered.
The ambulance strike teams brought into the county in January were supposed to temporarily supplement our current resources. Each ambulance cost thousands of dollars per day to operate. During the days they were here, they were used just 19 times to transport patients. And now there is discussion on whether they were utilized in the best way possible.
When you see and hear this, that's when you know there's an emergency. For many fire departments, medical calls are a huge part of the job. Emergency medical response accounts for nearly 70% of calls in the city of San Diego. In 2021, San Diego Fire Rescue responded to an average of 326 emergency medical calls a day, but staffing shortages and delays at the hospital during the pandemic have made 911 responses complicated. This was the county EMS medical director at the end of December.
Do we have all the resources we need, the staff, and the structure? And to be honest, it's pretty tight right now.
To help with that, the county brought in 2 ambulance strike teams, one from out of county and one made up of ambulance providers within the county.
And to my knowledge, I don't believe that bringing in strike teams of ambulances has been done before for a situation like this, but we haven't had a pandemic situation like this before.
Escondido Fire Chief Rick Vogt serves as a San Diego County Fire Chiefs Association president. A county spokesperson confirmed one strike team made up of 5 ambulances helped with basic life support. Another strike team of 5 ambulances helped with advanced life support. These vehicles are set up with more life-saving equipment and paramedics. Emergency medical services expert and paramedic John Everlove knows how these teams work.
You not only get the benefit of the vehicle, but you get the benefit of the personnel being utilized to supplement existing personnel allocation within a certain area.
According to the county, both teams started January 22nd. One was released on the 28th, the other the 31st. The estimated price tag, roughly $341,000, according to the county. The county footed the bill with money from the American Rescue Plan Act, funding to help with the pandemic. For these 2 strike teams, during the time they were here, there were a total of 53 requests for 911 responses and just 19 transports. That breaks down to nearly $18,000 per ride if you look solely at transports.
Do you feel like this was money well spent?
I feel like bringing in the capacity to San Diego County was absolutely a prudent move and money well spent, simply because, we had a need and we had a crisis that we were right on the edge of.
So why weren't the ambulances used more? At least 2 other fire officials told me they made clear to the county the main issue was the wait time at the hospitals, waiting for a bed to be available for the patient. Carlsbad's fire chief, Mike Calderwood, said that he did make their concerns known to the county about that issue. The county confirmed strike teams were used for at least 4 offload assistance assignments, helping relieve first responders waiting for a bed for the patient. But Vista Fire Department's operations chief said that when he tried to use the strike team to help with offloading because of the long wait time, the county duty officer denied it. He doesn't know why.
The solution that was brought forward by the county to bring in some extra ambulances was a prudent one. How they were used, that really is a decision of San Diego County Emergency Medical Services.
I checked in with both Falck and AMR, 2 of the largest local ambulance providers. Both said they were not involved in the decision to bring the strike teams here. Nobody from the county would comment on camera. A spokesperson confirmed they requested the teams after fire chiefs reached out to San Diego County Fire with a plea for assistance. When I asked why the strike teams weren't primarily stationed at hospitals to help with the delays, the county said the strike teams were to prop up resources needed at that time. I questioned the major local hospitals if they communicated with fire departments about strike teams to help with wait times. Was there communication with the county? Both Sharp and Scripps told me I needed to ask the county that. UCSD Health told me I needed to put in a public records request for information. A Kaiser spokesperson said they did tell the county they needed the support and submitted the required paperwork. She said, to our knowledge, we did not receive any assistance from the strike teams while deployed. Tri-City never got back to me.
When used correctly, how critical or how important can these ambulance strike teams be?
Literally, they can be the difference between life and death.
In response to its overall use, the county said although this step was somewhat unprecedented and didn't have a more significant impact, other measures taken by county EMS, improved conditions on the ground, and declining rates of infection led to a decreased need for the strike team ambulances. He didn't specify what other measures were taken.
You know, anytime we have a deployment or a situation like this, you can always look back and learn from it. That's why we do after action reports. I'm not going to at this point, say that things could have been done better or things didn't go well. I know that that's certainly going to be looked at.
The county also confirmed some ambulances were used to backfill at least 2 fire departments in 2 instances. The fire officials I spoke to did say they were glad the county did something. We still have to wait for the final report on the strike teams for the official price tag. That could take a few weeks. Melissa Masiha, Team 10.
And if there's a story you want Team 10 to investigate, send us an email to team10@10news.com.